Welcome to Lifestyle Medicine Week. We are delighted to have you here with us today. I'm Dr. Beth Frades, and I'm joined by Dr. Prachi Garodia. We're going to talk to you today about staying calm. Let's dive right in. I'd like to share with you some of my own experience, and then I'll share some research and data as we are evidence-based. I myself have used running, healthy eating, and sound sleep to keep me calm through my lifetime. And it wasn't until about 16 years ago that I started thinking I needed something different. And in fact, I think I had been in pre-contemplation about yoga and meditation for a long time. Friends would say, "Oh, yoga is terrific. Meditation's terrific. You really like it." And I am a New Yorker and I'm a runner and I like to do. So I didn't understand how sitting was going to help me do. And back 16 years ago, do was very, very important to me. And then I had babies, two boys that were 4 and 2 years old, and life was very busy, busier than it had ever been. And suddenly the exercise, the healthy eating, and the sleep were simply not enough for me to get into a calm state, a state of inner peace that I wanted for myself, my self-care. And that's actually when I started yoga. Then I was enjoying yoga for many years, and meditation hadn't entered in quite yet. I felt like yoga and exercise and sleep and healthy eating was doing it for me. And then my father died and my mom moved in with me and she had dementia. And that was, again, a time of increased stress for me. And it was difficult. And 3 years into mom living with me, with my teenagers and my husband and my work and trying to write, I found that I needed something else. So I actually I searched stress reduction for people who are caring for dementia patients. And I found mindfulness-based stress reduction was what came up in the literature many, many times. So that's what I did. I found that in the literature, and the very next day I called John Kabat-Zinn's group at UMass Worcester, not far from me, to complete a CME course, a 5-day course in mindfulness-based stress reduction. And I will let you know that this is personal experience, but the yoga and the MBSR have changed me significantly for the better in the mind. And I also believe physiologically, we'll see some of the research and go through this together. Starting with yoga, I'd like to share with you some data on yoga's potential for promoting healthy eating and physical activity behaviors, two of our main pillars. How does yoga influence these two? And they're also two very important ways to stay calm: healthy eating and physical activity. Interestingly, in this study, it was with young adults. There's about 1,820 who filled out self-report questionnaires, and a small segment of this study also were involved with semi-structured interviews. And the outcome of the study that was reported is that those young adults that regularly practice yoga actually consume more servings of fruits and vegetables and fewer servings of sugar-sweetened beverages and snack foods. They less frequently consumed fast foods, and they also participated in more hours of physical activity. This is a chart from that study, just showing you those that were practicing yoga. There's a higher frequency of them never consuming fast food, and they were less likely to consume sugar-sweetened beverages and snack foods compared to those that did not practice yoga. And those results were statistically significant. Now let's look at some studies wondering about the mechanism as to how yoga works to keep us calm and make us feel good. This is a systematic review of 5 studies reported in the literature. And looking at these 5 studies in terms of psychological mechanisms, they conclude with yoga, we're more likely to have a positive affect. So experience positive emotions, share those emotions, and in terms of our relationships with others, share more positive emotions too. We're also more likely to have self-compassion. In terms of the biological mechanisms noted in this study, those practicing yoga have an inhibition of the posterior hypothalamus, reporting lower cortisol levels in those practicing yoga. Another systematic review of 42 studies looking at the physiologic measures associated with yoga practitioners showed that those practicing yoga had reduced evening cortisol and waking cortisol, lowered ambulatory systolic blood pressure and resting heart rate, and they also had lowered fasting blood glucose, cholesterol, and LDL, low density lipoprotein, compared to controls. Now, if we go specifically into the immune system, which is something that a lot of us have been thinking about over the past year with COVID, we can see a small study of adult women, 23 in this study, and they were evaluated pre and post yoga, and they looked at secretory immunoglobulin A, cortisol, and testosterone in these women. Turns out the secretory immunoglobulin A concentration and secretion rate were significantly higher after yoga than before. The cortisol concentration and secretory rate were lower after yoga, and testosterone secretion rate was higher after yoga. So the conclusions in this study were that yoga stretching can reduce stress and enhance mucosal immune functioning in elderly women. Of course, more research is needed. This is a small study. You know what's out there when we're practicing yoga ourselves and when we're recommending it to others. And for me, the numbers and the data make a difference. Let's move to mindfulness and the immune system. This is another systematic review of 20 randomized controlled trials, and this was in mindfulness-based stress reduction, which I mentioned I took with John Kabat-Zinn's group, a specific type of mindfulness-based stress reduction. And about 1,602 patients were included in this study. And the results showed that those that do MBSR have reduced nuclear factor kappa B transcription activity, reduced C-reactive protein levels, and they have increased CD4 T cell count and activity, and increased telomerase activity. You may be wondering, so what's the dose of this? Because we talk about exercise as medicine, we talk about a dose. And what is reported in the literature is weekly group sessions, about 60 to 90 minutes. And if you can do this for an extended period of 6 to 10 weeks, you may be able to see and experience some of these results for yourself. When we look at the brain, we think about Sarah Lazar and meditation and her work here at Mass General Hospital. Pretty profound results she reported with meditators versus non-meditators, and looking at their thickness in their cortex. So here on the bottom left, we have the insula, and then on the right, we have the prefrontal cortex. The x-axis is age, and the y-axis is thickness of the cortex, the specific area here, the insula. Meditators are those dots in blue, and controls are in the red. And as you can see, the meditators had a higher cortical thickness for the insula as well as for the prefrontal cortex. Again, the blue are the meditators and the red are the controls. This is pretty significant. So if you think about what our prefrontal cortex does, many things, but complex behaviors, executive functioning, emotional control, behavioral functioning, and then the insula, self-awareness, perception, and cognitive functioning. So when we meditate, when we do mindfulness-based stress reduction, when we participate in yoga, we're giving ourselves a nice time out, taking time for ourselves, and it can impact us psychologically, physiologically, and even help our immune system. Now, more research needs to be done in this area, but if you're interested and you're moving from contemplating yoga and meditation and you're getting into preparation, maybe this will push you over into some action. And we're going to have Dr. Prachi Garodia tell us a little bit more about meditation, and even you'll be able to experience some with us today. Thank you so much.
Hi, thank you so much, Beth, for having me over at the Lifestyle Medicine Week. I'm so thrilled and excited to be here. My name is Prachi Garodia, and I'm an internal medicine MD, board certified in integrative medicine and lifestyle medicine both. And I've been practicing integrative medicine, evidence-based in my practice for the last 20 plus years. And a lot of things learned in the way. My journey started when I was really young. I was around 4 years old, and I grew up, looking at my dad practicing yoga and meditation. So that sparked the desire to learn more about it. And when I went to medical college, that's when actually I took formal training. I was just sort of sitting on the thought process of yoga and meditation. But it was in medical college when I started learning about how the body and the mind works that really sparked my deep interest. So I took formal training in yoga and different styles of meditation at that time. And that really opened up another realm of healing for me. So I love to share some of that about the good things we can do to stay calm and, really grounded in the moment. But before that, I would like to briefly touch on, the stress epidemic, which is really hitting us very hard right now. So advance to the next slide, please. So what is stress? Stress is a state of physical, mental, or emotional strain or tension resulting from very demanding or adverse circumstances. It is anything which will cause a strain on the body or the mind. It can be really beneficial in the short term, but if left uncontrolled for long term, it can be very, very harmful. And we have all realized that because the whole planet has been going through an unprecedented amount of stress with the COVID-19 pandemic. There have been a lot of researches and there have been a lot of studies in the field of stress because that really impacts human health directly or indirectly. It causes around 90% of chronic and acute illnesses. And we'll touch base on that, but increased rates of heart attack, hypertension, obesity, addiction, anxiety, depression, psychotic issues, they are directly or indirectly related to stress. So these are some stats from APA, the American Psychological Association, 2017, and they do a source every year. And there has been an increased amount of stress, at work regarding the future of our nation, regarding financial crisis and unemployment, increasing violence, increasing crime. All of those have really come to a forefront now. Between 1983 and 2009, the stress level increased by 10 to 30% among all demographic groups in the US. So this is very brief. I won't go very in detail of this slide, but it shows how stress can affect the body and mind, including causing heart rate and blood pressure to go up, because you're trying to improve decision making. The blood sugar rises, secondary to extra cortisol release, and it results in breakdown of glycogen, fat, and protein stores. Blood is shunted away from the gut, and it's not immediately needed for purpose of digestion. And it's diverted back to the large muscles of the arms and legs to provide more strength. Clotting can occur more quickly. So all of those things will happen. It impacts your immune system, it impacts your sleep, it impacts your moods. Nowadays, the contemporary stress levels are very persistent because it stems primarily from psychological rather than physical threats. In the past, ages, they were used to be saber-toothed tigers and, some adversary animals who were trying to attack us, which we had to fight. Those were temporary. We were not living in a constant mode of stress. But right now, we really don't have any control over the amount of stress we are surrounded with or the reactions our body and mind go into. So next slide. So we are the most stressful and anxious country in the world, and that's not a good thing. So these are stats from 2012, but they have, shown to be basically same results all through since then. There are 1/4 of us who live with anxiety and depression. And so mindfulness has actually emerged as the answer to that epidemic. It's the #1 clinical tool for stress, depression, anxiety, and pain. It's shown to be really great training for IQ, emotional quotient, attention, and stress resilience. And there are hundreds and thousands of published researches over the last couple of decades. It's a 1,000% growth in the 10 years, becoming leading field in the mind science. So let's learn more about what exactly is mindfulness and meditation. And there are you might have heard about a term called MBSR, which is mindfulness-based stress reduction, which is a practice which Dr. Pretis also did her CME in, and that she found really helpful. And that has shown to reduce stress, improves emotional regulation, and have several benefits leading to better mood, better ability to handle day-to-day stressors. This is the biological mind-body mechanism depicted on this slide, and it can get a little complicated, but just the gist of it is it works on different organs, interconnecting them from the brain to the adrenals, to the digestive system, the gut microbiome, your immune system. And there are key signaling pathways which have been studied, which either up-regulate or down-regulate, depending on which mode we are in. And definitely what we can do, which will improve the stabilization and maintenance of this in a balanced mode. So positive emotions, promoting social bonding and change in lifestyle habits will come as a result of balancing these mechanisms. So Viktor Frankl, who was a Holocaust survivor, he mentioned the only thing you have control over is your ability to control your own reaction. So between the stimulus and the response, there's a space, and therein lies our power to choose our response. In that response lies our growth and our freedom. So let's learn how to be in that space and make conscious decisions. Ancient contemplative practices have shown, in multiple studies, have shown a range of positive psychological outcomes, such as improved cognition, improved emotional regulation, and even neuroplasticity in a positive way in the brain. So I really wanted to stress on this slide that social support and connections really matter. Always wearing a smile because it invites positivity, like attracts like, and help maintain a positive attitude, because your attitude can make or break you. So you can interpret the same situation or trigger either negatively, positively, or indifferently. And obviously having a negative attitude goes along with more stress. I also want to remind everybody that it's very important to have self-compassion. And self-compassion, being warm and understanding towards ourselves when we suffer or fail or feel inadequate. So treating ourselves like we will treat our best friend or somebody else rather than self-judging and being hard on ourselves. And also knowing that we are all humans, we are vulnerable, we are imperfect, and it's not just what's happening to you, it's happening to all humanity. So holding the space for yourself and not being too hard. And also learning how to be mindful rather than over-identifying with your thoughts and feelings and trying to suppress or deny them. Just being, observing your feelings. And we'll talk a little bit more about mindfulness without judgment, paying attention in the present moment. So a little bit about meditation. So Richard Stein, a cardiologist at New York University Center of Prevention of Cardiovascular Disease, says, think of it as a 20 or 30-minute vacation from the stress in your life. And it definitely impacts heart health very positively. There are little tips on how to start meditating. Focusing on the breath is a free tool, which everybody can access anytime. Sitting in a comfortable position, whether you're sitting on a chair or a cushion, that's your choice, because whenever you want to sit for meditation, you want to be comfortable. That's the first step. And then watching your thoughts and emotions float by rather than engaging with them, and just bringing back to the object of your focus, whether it's your breath or a candle or a word, whatever you are focusing on. Eyes can be closed or open, softly gazing ahead of you if you feel comfortable that way. And then you can do it any time of the day, meditation, and it can be done in brief moments of 30 seconds up to a few minutes, or you can extend it to a few hours if you have the luxury of time and space. The relaxation response was a technique which was developed by Dr. Herbert Benson with who is a Harvard physician, and Miriam Clipper. And they wrote a book together in 1975. And since then, they have written several other books. And they found in researches that this induces a physical state of deep rest that changes the physical emotional responses stress, which is directly opposite to the fight and flight response. So when your heart rate is up, your blood pressure is up, once you practice the relaxation response, everything relaxes, including the body and the mind. So, and again, the technique is very simple. It's a simplified version. Decreased metabolism, rate of breathing, increasing peace and contentment were some of the side effects of the relaxation response. So I think we're going to transition into our mindful practice. I will I'll review a very simple deep breathing, abdominal breathing practice, which you can do anywhere. And you don't have to tell anybody. Nobody will notice that you're focusing on your breath. Very important for practitioners and physicians and healthcare workers to practice an in-between patients or whenever they are feeling not grounded. So we'll review what is involved. There are several studies which have been done which showed that by consciously engaging the diaphragm, the system shifts over to the parasympathetic nervous system and activates it, and they can lower depression, anxiety, and foster emotional well-being. So basically, if we can relax ourselves enough to breathe like a baby, and baby always breathes, they breathe from the tummy. So I will encourage everybody to settle down as we go into the experiential. Settle down comfortably where you are And just be careful to keep your spine straight, but not stiff. So just relax your shoulders, settle down, release muscle tension. Whatever is unnecessary tension, just relax and let it go. We will take 3 deep breaths to start with, just to expand the lungs and get the body used to breathing deep. And after that, we'll revert back to our normal breathing. And the breathing is in and out through the nostrils. Again, you can close your eyes or keep your eye gaze soft and lowered in front of you. So go ahead and start with the practice. I'll start the guidance. Taking a deep breath in through your nostrils and expanding your belly. And then exhaling it out through your nostrils. Feel the body relax as the breath flows out. Taking another deep breath, full breath, extending and expanding your tummy. And then exhaling out, intimately aware of the breath sensation and movement as it's flowing through the body. With the next deep breath, follow and focus on the beginning, middle, and end of the breath, maybe, if you can pay attention to that. Following the flow of the breath and being intimately aware of the sensation and movement, the natural rhythm it settles into. Very gently flowing into your lungs and then into your belly area. Maybe paying attention to the beginning, middle, or end of the breath, naturally, very gradually, like it flows always, without being too noticeable. And it's very natural that mind might wander, which is mind nature. Just gently bring it back and start following the breath as if you're doing the breath for the first time. Feel the expansion of the chest and belly with each in-breath, and feel the fall and getting back of the belly with each out-breath. And very gently start moving your feet, coming back to the same comfortable position you were in, and carrying on this intention to the next step in your day. Thank you so much for being here and for sharing these beautiful moments together. And I hope you'll continue to share with the rest of your loved ones. Thank you.